So keep in mind that orders cannot be billed until they have been QA'd. So we're going to be discussing process of orders in your orders manager's screen. So when you go to orders manager, just want to also, as best workflow practice, keep in mind that orders should be returned with a signature from the physician within 30 days. When you're in your orders manager screen, let's discuss the layout of the screen. You have a tracking bar located at the very top. Here are all your orders that need to be sent to the physician. Bottom here, by order number, patient name, the type of order, the physician you will be requesting a signature from. This column will be if your physician, such as Dr. Sheldon Cooper, is a part of physician's access. You're going to see a marker here in this column, just a red and black dot, indicating that Dr. Cooper accepted your agency's invitation to participate in electronically signing visits, or orders rather, electronically signing orders. And as soon as he accepts that invitation that you sent approximately 60 days after your agency has been using WellSky Home Health application, that's our recommendation, by the way, then you're going to see that he is participating in that program. And you can always go to online help, type in invite a physician, and take a look at the article as well as the instructions on how to invite your physician after about 60 days of using it. Okay, so getting back to orders, here's the date that the order was originally ordered. And here in Orders Manager is your version as an individual who's responsible for the orders of writing your yellow sticky note. That's clicked here. And you can write things such as, I faxed the order over to Dr. Sheldon Cooper on December the 11th, 2018 at 11:41 a.m. or any specific note that you like to write to yourself. I have about 8 orders that need to be sent to the physician. So let's go ahead and send Colette's order over to Dr. Koothrappali. I can do that by clicking on Colette's name, the patient, or the checkbox next to her name, and we're going to send her face-to-face order over to Dr. Koothrappali. Now, what I could do is I can print Colette's order, or I can add a bulk comment if I'm going to be selecting multiple names. So if Justin was also a patient that we were working with yesterday, if I want to add that I faxed over or used e-fax or whatever your current process right now is, you can certainly go ahead and check this name, add a bulk or comment, add a yellow sticky note to both of their notes here. Put your initials and then click save. Just as a note to yourself. You won't be using print and removing orders as often, but when you are physician for signature, you'll use the check out method. And from here, Justin and Colette removes from your list and they will go to pending physician's signature list, where you have a list of all of your patients where you're waiting for a signature from the doctor. Based on what I can read in my filters here at the top, I have 16 orders awaiting signature here, to include Linda, Natalie, Mac, as well as Justin. And I should see Colette's here, her face-to-face order as well. And of those 16 orders, 13 of them are greater than 7 days old, meaning as a clinic setting, I set where I will receive an alert when my orders are greater than 7 days old. And I have 13 of those. And of those 16, 8 of them are face-to-face orders that are greater than 30 days old. To your right, you have your pending by days filter bar. If I click on any color, I can see all of my orders that are within 0 to 7 days old. And I have 3 here, Louise and both Colette, with different last name spellings. And if I have any older orders greater than 120 days, and hopefully your agency doesn't look like my fake agency, I can just click on the bar or the color there and see that I have those orders there. And you may want to prioritize as something to think about by age to know which physician to nudge there. You can just click on your number to get back to your orders. Now let's talk about these new columns that you see here. What does this mean for Erica? We, as the orders managers, I actually sent this PT evaluation to Dr. Koothrappali originally on May the 29th. In other words, in the software application, I clicked on that checkbox, checkout button for the first time, sending a notification over to Dr. Koothrappali by faxing that order or mailing it. And I did that on the 29th when I checked that button, checkout. The last time I sent a reminder to Dr. Koothrappali that we are still waiting on your order was on September the 27th. And then it's possible, since this is greater than 232 days old, that I'm tracking any type of notifications for this patient, and it looks like actually I'm not, or I didn't, or I can start that process now. It says call the patient before 30 minutes. So this looks like a scheduler's note. And this is why it's so important to make sure that you put your initials next to it, just so you can manage who's writing what yellow sticky note for what visit or order. But you certainly could do that there. And so how did I get this to change? In other words, when let me get ones, let's say for here, let's say I sent another printout version of this PT eval with the cover sheet to Dr. Koothrappali today. I'm going to check the name here and document the last time, and then I'm going to click on resend for today's date. Documenting that I did make contact, or at least attempt to make contact, with Dr. Koothrappali's office about Erica's PT eval order there. Now, once I receive that signature, let's say Dr. Koothrappali responds back and he has signed off on that order. Once you receive that signature, however your workflow works right now, what you'll do in the home health software to indicate that you've received that signature, you'll click the checkbox there next to Erica's name. And let's say I received Colette's signature there, and one, let's say for Cliff or Dr. Gable Hauser. I'm gonna click that there. Now I'm going to click check in, because I received the signatures into my agency. And now those 3 patients are going to be in the receive tab. There's Erica there, Colette, and Cliff. When you first get into this receive tab, your start and end date is going to be the current day. If you need to change that date range, just go ahead and make the change within the calendar and run that report of all of the signatures that you received within a certain time frame. In any of these areas here, whether it's your waiting signature or you're ready to send request for signature, you can always export all of that data into an Excel spreadsheet. In this case, I'm in the receive tab, and I can see all of my received signatures in that Excel spreadsheet. Now, when I go to tools and reports, if I want to create an Excel spreadsheet for all of my orders that need signature, waiting a signature, and have been received, I can do a details orders export, and it's going to pull over all those patients and orders in these tabs. If I want to print an orders batch, because my agency may be faxing over orders or electronically faxing orders, I can do that for, let's say, Dr. Gable Hauser. And I can send a cover sheet as well as a copy of the orders by clicking on print here. And I can see a list of his orders here, which is for Cliff, and quick overview. And I can see a copy of Cliff's order there that I can send over to Dr. Gablehauser. If you don't see a phone number or fax number located on any print screen, that's just indicating that you will need to, as an administrator, go into the profile of Dr. Gablehauser and update that information. And that's under Reports Admin, underneath Physicians. Right, and you'll use the back button, Sisters Preview Overlays over your original screen. And there's nothing to save there. And I click back twice, so that's why it takes me back here, but otherwise I would be here if I clicked it once. So underneath Tools here, this is where you will actually check to see orders outstanding by physicians, and then which of those orders are actually preventing final billing. Let's talk about these two areas here. Let's go to orders outstanding by physician. And then when you're in this screen here, what is this screen actually communicating back to us? Let's work with this top line. Based on what I can see, Dr. Kuthapalli himself has 11 outstanding orders. Of those 11, there are 9 of them that exceeds our agency's past due date. And let's see which ones they are. So I'm going to click on the 35 here and then dissect which of those notes are really, we're waiting on his signature because the orders manager has already clicked that checkout button and sent the orders over, and we are waiting for those orders. And that's here. So let's see. I'm going to click on that. And once I click on that 35 there, it takes me into that next tabs of my tools and reports of orders preventing final billing. And I can actually filter this out by the payer type as well. I'm going to keep mine on all payer types and then show you how to read this screen. When, as an orders manager, first thing I would recommend that you click on status so you can actually see who should possibly receive more training and sign them up for more orders managers training, and which ones are actually being held up by the physician. So if I see the completed status, of course, that means my orders have, of course, been QA'd and approved, but they're still sitting in this to be sent tab. So if you see several of these, that could mean possibly need to hire another QA, another orders manager, because they're not getting those orders over into this pending signature, physician signature quite fast enough. Or maybe they need to attend another webinar. If you see physicians' orders that are not started, these are not necessarily responsibility of Dr. Kuthapalli in a sense that your clinicians have not opened up these orders here to complete them at all. So they are late. Remember, not started is late as a result of watching the life cycle of clinical note prerequisite video to the training. Not started means late for your agency. Returned for review and submitted with signature does indicate that the clinician did sign off on the order and they sent it over to QA. Save just simply means that the clinician did open up this PT eval, for example, and at least entered in a time in, time out, and a visit date, but it's still an incomplete order. So it's not something, it's not even in the orders manager's queue just yet. However, these were sent to the physician, all of these, which should total 9 there. These are the ones you want to at least note that these are holding up final billing right here for Dr. Kuthapalli. In other words, these are sitting in this area here for pending physician signature. We're still waiting on those.